This topic is physiological changes during pregnancy, part 2. Placental hormone levels during pregnancy can be seen in this image and change depending on which trimester the client is in. Human chorionic gonadotropin, HCG, is released from the fertilized ovum and chorionic villi in the first trimester. HCG stimulates the production of estrogen and progesterone by maintaining the corpus luteum. Human placental lactogen, also known as human chorionic somatomamotropin, HCS, is developed in the placenta and contributes to breast development. It is an insulin antagonist and it impacts the maternal metabolism. Estrogen is initially secreted by the corpus luteum in the first trimester, but is later produced by the placenta. Estrogen aids in the enlargement of the uterus, breasts, and genitals. It helps prepare the breast for lactation. And estrogen also helps relax the ligaments and joints of the pelvis to prepare for delivery of the fetus. Progesterone is initially secreted by the corpus luteum in the first trimester, but is later produced by the placenta. The main functions of progesterone are to thicken the lining of the uterus for pregnancy, prevent contractions to maintain the pregnancy, as well as maintain and support fetal development by stimulating secretion of specific proteins. Relaxin is secreted by the placenta and corpus luteum, and it works with progesterone to maintain pregnancy. Other actions by relaxin include increasing pubic symphysis flexibility and inhibiting uterine activity and contractions. And prostaglandins, which may be responsible for reducing placental vascular resistance. And they may also contribute to cervical softening and the initiation of labor. Early physiologic changes, which are subjective or presumptive signs, can help to identify pregnancy. The earliest sign of pregnancy is when the client misses one or more menstrual periods, also known as amenorrhea. Nausea and vomiting is another sign caused by increased HCG levels and changes of carbohydrate metabolism. As the body adapts to pregnancy, the client will notice excessive fatigue, which can last through the whole first trimester. Urinary frequency is a sign caused by the uterus putting pressure on the bladder. And breast tenderness and enlargement, which are caused by increased hormone release, may be felt by the client who is pregnant. Lastly, quickening, which is the maternal perception of fetal movement and can feel like a fluttering sensation. Quickening initially occurs between 16 to 20 weeks gestation, and the intensity and frequency will gradually increase in the abdomen. Objective or probable signs of pregnancy are observed by the healthcare provider when they are performing an assessment, and they include changes to the uterus and cervix. Within the first 3 months of pregnancy, vascular circulation to the pelvic organs increases and causes congestion. Signs of this include the Goodell sign or cervical softening, Chadwick sign, blue coloration of the cervix, vagina, and vulva, Hagar sign, which occurs between 6 to 8 weeks gestation and is the softening of uterus's isthmus, and uterine enlargement. Other signs are Braxton Hicks contractions, which are irregular contractions that can occur any time throughout the pregnancy and are often painless. Ballottement, which is detected when the healthcare provider palpates the cervix and feels a rebound from the floating fetus moving up and down. And fetal outline palpation, which can also be palpated during the assessment. Additional objective signs the healthcare provider may assess include uterine and phonic souffle, which is a blowing sound that is congruent with the maternal pulse rate and is auscultated over the uterus. Skin pigmentation changes and striae gravidarum. For more information on these changes, watch our Physiological Changes During Pregnancy Part 1 lecture video. And a positive pregnancy test, which is determined based on the HCG detection in the maternal blood and urine. Healthcare providers can identify positive, which are diagnostic, signs of pregnancy with a Doppler device, like in the image on the left. This can be used to detect the fetal heartbeat, which is initially detected at about 10 to 12 weeks gestation. Or an ultrasound, like in the image on the right, may also be used to detect and visualize the gestational sac up to 4 to 5 weeks after the last menstrual period. Or the fetal heart rate activity by 6 to 7 weeks gestation. And lastly, the healthcare provider can palpate or observe fetal movement after 20 weeks gestation as a diagnostic sign of pregnancy.